Hello ladies, welcome back to my channel. Today we are going to discuss a topic that many women find uncomfortable to talk about: recurrent infections. If you find yourself dealing with infections more often than you would like, you are not alone. But don't worry, we are here to help you understand why this might be happening and what you can do about it. So keep watching. Ladies, this is why you keep having infections. Before we get deep into the detail of this video, make sure to subscribe to this channel and hit the bell icon to get notified of our latest videos. Now let's get started. Your current infections can be frustrating and uncomfortable, but they are often a sign that something is out of balance in your body. Here are some reasons why you might be experiencing recurrent infection. One of the most common reasons for recurrent infections is the overuse of antibiotics. While antibiotics can be effective in treating infections, they can also disrupt the balance of good and bad bacteria in your body, making you more susceptible to infections in the future. When you take an antibiotics, the good bacteria in the vagina that helps keep yeast in check may also be harmed. Frequent antibiotics use can allow the yeast to thrive, leading to recurrent yeast infections. Now, consuming probiotics while you are taking an antibiotics or after finishing an antibiotics can help restore the beneficial bacteria that help keep yeast infections away. You can increase your consumption of probiotics by eating food rich in probiotics, which include yogurt, fermented foods like kimchi, kombucha, sauerkraut, and pickles. Even miso soup as well is a good source of probiotics. Hormonal imbalance or hormonal changes can also make you more prone to infections. For example, fluctuations in estrogen levels during menstrual cycle, pregnancy, or menopause can affect the pH balance of your vagina, influence the growth of candida infection, and also increase the growth of harmful bacteria. A mild yeast infection might clear up on its own, but often you will need to treat the fungus to get the infection to go away by getting antifungal medications, which comes in oral drugs and also pessaries to be inserted in the vagina as well. The third reason why you keep having recurrent infection is weakened immune system. Your immune system helps fight off harmful organisms that can make you sick, including an overgrowth of yeast in the vagina. A weakened immune system can make you more susceptible to infections. If you are not getting enough sleep, or you are stressed out, or have an underlying health conditions like diabetes, your body may not be able to fight off infection as effectively. If you experience recurring yeast infection as a result of weakened immune system, you may need more intensive treatment than the standard over-the-counter antifungal creams and medications, which your healthcare provider will provide for you. Poor hygiene can also contribute to recurrent infections. Wearing tight or synthetic clothing, not changing out of wet clothes promptly, and using harsh soaps or douche can disrupt the natural balance of your vagina and make you more prone to infections. Yeast thrive in moist and humid conditions. So anything that traps moisture in the vagina, like tight fitting underwear, can increase the risk of your yeast infection. Regularly wash your vagina with only water. Avoid the use of soap because it can disrupt the pH balance of your vagina. Do not attempt to clean the vagina with other methods like douching or perfumed powders and sprays, as these practices can disrupt the natural pH balance of the vagina as well and increase the risk of yeast infection. Wear underwear made with breathable fabrics like cotton and change your underwear after working out to avoid moisture from sweat building up in the vagina area. And finally, the last reason why you might be having recurrent infection is that you have a different kind of infection from what you are treating. If you are experiencing recurrent yeast infection that are not responding to treatment, you may actually have an infection that mimics a yeast infection, but it's something else like bacterial vaginosis. Both bacterial vaginosis and yeast infections are caused by an overgrowth of certain microbes in the vagina that can cause inflammation, itching, burning, and discharge. But bacterial vaginosis is the result of an overgrowth of bacteria, while yeast infection is the overgrowth of fungus. Bacterial vaginosis presents with many of the same symptoms as yeast infection, like burning, itching, and irritation. It can be tough to tell the difference, but if you notice an unpleasant fishy odor and grayish discharge, this may be sign you have bacterial vaginosis and not a yeast infection. But this can also be confirmed by running a medical test on yourself before you commence treatment on any of the infection you have. If you believe you have a yeast infection that isn't responding to over-the-counter treatment or seems to improve but then comes back, consult your healthcare professional to run a thorough test on you and find out what the problem is. Additionally, you can take steps to prevent infections by practicing good hygiene, eating a balanced diet that helps with your hormones, managing stress, and getting enough sleep. And also take your medical checkups seriously. Thank you so much for watching. If you find this video helpful, make sure to give it a thumbs up and share with your friends. And don't forget to subscribe to my channel for more informative video on your health. Ladies, if you have any question, you can drop it in the comment section down below and I'll address them accordingly. And if you also want similar videos on ladies' health, personal hygiene, make sure you let me know in the comment section down below and I'll address them through this channel. Thank you and see you in the next video. Bye.